Hello, I'm Andrew Cuomo. Politics and government have often been intertwined. That is nothing new. Political concerns very often factor into major decisions at the highest levels of government. The COVID crisis is an example of the danger posed when political interests outweigh the interests of the American people. 4 years later, we still have not addressed the substantive public health issues presented during COVID because they are eclipsed by our hyper-political environment. With all the distracting topics consuming attention in this political year, I think it is safe to say that management of a pandemic should be at the top of the list. Facts are still facts, even today, even in this environment, and time has revealed the truth. It always does, and the truth matters. Today, 4 years later, the results are clear. The nursing home controversy was the most destructive example of the Republicans' politicalization, deception, and abuse of government during COVID. It was a complete fraud, and it created misimpressions that continue today. Nursing homes were where the tornado touched down, not just in New York, but across the nation. Nursing homes were the locations of the greatest number of deaths and saddest human tragedies. By the end of 2020, the first year of COVID, the death rate across the country for non-nursing home residents was 87 per 100,000. For nursing home residents, it was 9,200 per 100,000. That is a 108 times multiple. For Americans 65 plus, the death rate in nursing homes was 23 times greater than for people 65 plus who were outside of nursing homes. 23 times greater. In the hardest hit states in the country, Rhode Island, Indiana, New Jersey, South Dakota, and Connecticut were the top 5 hardest hit. More than 12% of the nursing home population died from COVID between January and December 2020. So nursing homes would be the focus of the COVID tragedy. That was clear early on. And the White House would need a foil. And their story would be Democratic governors were in charge and Democratic governors failed. All that was left to do for them was to construct that narrative. Republicans focused their attack on New York for political reasons. In reality, New York's nursing homes performed well in comparison to other states. In fact, New York was in the top third of lowest nursing home deaths pro rata. Attacking New York and other Democratic governors was just fundamentally disingenuous. As usual, it is most easy to mislead the press and the public in situations where there is limited knowledge, especially in technical areas, such as healthcare policy in nursing homes. And I think that's what happened here, and they took advantage of it. Nobody really knew the facts and the policy, but now it is important to actually understand how it works. The nursing home system is generally regulated and funded by federal Medicaid and Medicare, administered by CMS, the Center for Medicare Services. The CDC, Center for Disease Control, is the federal regulator for infectious diseases. During COVID, the CDC and CMS issued guidelines for COVID management to hospitals and nursing homes. States, as a usual matter, follow CDC and CMS because the states rely on federal Medicaid and Medicare funding as their major source of financing for the healthcare system. In early 2020, just as COVID began, the CDC and CMS issued guidance. Specific guidelines were issued on March 4th, March 13th, and March 23rd. Remember, New York announced its first case at the beginning of March, so this is very early on. The CDC and CMS policies were then widely circulated to the healthcare community. 2 days later, on March 25th, advisory from the New York State Department of Health followed the CDC and CMS policies. The Republican attack was that the New York March 25th advisory was the cause of COVID entering nursing homes. Republicans claimed nursing homes were forced to take COVID-positive people by New York's advisory, and many believed it. Their claim was a factual and legal impossibility. First, our Department of Health was following their federal guidelines. So if the policy was flawed, it was a federal failure. Again, New York only followed federal policy. And if it were true, then it would be a function of the federal guidance. Second, as a matter of law in New York, a nursing home is never directed to accept any patient, but rather has the discretion to decide whether or not they can accept the patient and if they can adequately provide care for the person. But facts didn't matter. The Republicans' charge was the governmental equivalent of yelling fire in a crowded theater. People heard New York was forcing nursing homes to take COVID-positive people who were infecting the facilities, and that it was a disaster. And that's what the headlines screamed. Families of nursing home patients were frightened, they were confused, and they were angry. None of it was true. The CMS and CDC policies were followed by states across the country, Democratic and Republican. As CMS and CDC officials explained, the policies were based on the belief that the patients they were releasing from hospitals to nursing homes were not infectious because they had been there for over 7 days and weren't symptomatic for 3 days. They believed that even if a person tested positive, after 7 days with no symptoms, their viral load, as they call it, was so low that they were no longer infectious. Also, remember the reality at the time. There was little testing capacity. So it was not possible for anyone to order testing of all patients. It was also clear at this time, the early days of the pandemic, that there was a real possibility that given the rate of the spread of the infection, there would be a shortage of available hospital beds. There were graphic examples of hospital systems collapsing in other countries. There is no doubt in my mind that had the hospital system collapsed here, the situation would have been much worse, and many more would have died, and the Monday morning quarterbacks would have really had a valid discussion. But again, this was just political theater. It was election year politics. Blame the Democratic governors for COVID deaths in nursing homes. Even today, 4 years later, I've never heard the CMS or the CDC say their policy was misguided. I've never read an editorial that said their policy was misguided. I've never heard President Trump or his officials say it was misguided. I've never heard Congress say it was misguided or the policy was incorrect. But they still condemn New York and the other Democratic states that relied on the CMS and the CDC policies. The decisions were made by the CDC and CMS and followed by the New York State Department of Health medical professionals in the normal course. That was the protocol. The political attacks continued, and they developed a new angle to advance their conspiracy theory that Democratic governors were covering up their mistakes in nursing homes by underreporting deaths. To continue their attack, they asked for additional information beyond the information we had been collecting from hospitals and nursing homes. What we were doing was this. Every day, New York State released the number of people who died in hospitals and the number of people who died in nursing homes. Despite all the confusion of the moment, we could be certain of those numbers. We were transparent and timely. I personally read the numbers aloud every day during nationally broadcast news conferences for months. We always said the numbers reflected the place of death, either a nursing home or a hospital. Tracking these numbers was an essential component of my briefings because it showed the evidence of the advance of the virus. However, the attack now had a new theory. They wanted New York to start a new accounting method undertaken in the middle of this pandemic. They wanted the number of people who died in hospitals, but had been sent to the hospital from a nursing home. The theory being that death should be charged to a nursing home and not a hospital. They argued those were out-of-facility nursing home deaths. It was basically a pointless exercise. It would not change the number of total deaths, but only shift the number of deaths from hospitals to nursing homes. And it wasn't even logical. If you wanted to count people who went from a nursing home to a hospital as a nursing home death, wouldn't you also need to count people who went from a hospital to a nursing home as a hospital death? So we should go through a tedious forensic accounting exercise, which would adjust the nursing home and hospital death numbers, but not change the total number of deaths, which was the truly relevant indicator. It was all about political advantage. For myself, as a governor whose decisions during an historic crisis could literally make the difference between life and death, I spent many sleepless nights thinking about what I should do during those terrible times. I prayed on it for wisdom, for strength to lead the state through the darkest days. I've spent many nights thinking about it since. I rethink every decision. And there are many, many, many things I would do differently if I knew then what I know now. Why didn't we know COVID was here when it first arrived? Did we close down the state too late? Did we give the best guidance as soon as we had it? Could we have moved PPE, vaccines, and life-saving equipment and personnel faster, better, or more efficiently? What else could we have done in nursing homes? In retrospect, even with all the press conferences and briefings, I could have communicated better about nursing homes. I believed at the time all the accusations were obviously political and that there was no credibility. Therefore, I didn't aggressively fight to bat them down every day. However, that allowed many families to believe the conspiracy theories about the blunders in the nursing homes causing death for their loved one. And that is a painful belief to carry, especially when it wasn't true. I'm a lawyer, former Attorney General of New York, former federal cabinet secretary. I know how the justice system can be weaponized for purely political purposes. I wholeheartedly believe Trump was using the Department of Justice as a political weapon. Trump hired the campaign manager of my 2010 political opponent to be the U.S. Health Department spokesperson. He was a pure political operative for the conservative and Republican forces in New York. He would work with Jeffrey Clark, the political operative of the Department of Justice, who is now indicted as part of January 6th. And I believe they were desperately seeking an indictment against Democratic governors, especially me. Why? Because it was a way to exonerate President Trump and again blame the Democrats. I told my team to only release information that we had verified. I knew that if any information was proven false, it would discredit the entire effort. And millions of people were trusting our daily briefings. What I told them I needed to know was true. Any false information would destroy the credibility of the briefings. And any false information would have also triggered charges by the Department of Justice. Despite the hospitals, nursing homes, and the Department of Health's best efforts, it took weeks to audit data, and the delay allowed the conspiracy theories to circulate. Another error in judgment I made is that I assumed the CDC and CMS and the other federal health agencies were doing their job competently and not politically, and that their guidance was thought through. I was wrong. Many top federal health officials have subsequently complained that they were politically influenced. The GAO has made that finding. If I could do it over again, I would tell our Department of Health not to rely on the federal government, that we should put together our own team of experts and craft a nursing home policy. The challenge for nursing homes is now clear. To have staff that don't leave every day to go home, interact with other people, get infected, and return to the nursing home the next day. They recognize this in Europe, and they try to model in Europe where the nursing home staff lived in the facility for the duration of COVID. In essence, it was a quarantine. The entire nursing home was a pod. I don't know that we could have found enough staff who would have been willing to do it, but it would have been worth exploring. There may have been family members who would have volunteered, or we could supplement the medical personnel, nursing home staff with the National Guard who could stay for a period of time. Anything we could do to avoid staff coming and going would have been helpful. Obviously, there are challenges with this approach also, but there were better options worth trying. And now we must learn from the past and prepare for the future. We have learned the dilemma of nursing homes in a pandemic, that once a test for the virus is manufactured and all the staff can be tested, the problem is alleviated. The problem was, and may be again if a new virus appears, that there will be a lag between the time the virus appears, a test is created, the test is manufactured, the thousands that are necessary are available to test the nursing home and healthcare staff. There will be a lag of time. And during that lag, it literally opens the entranceway of the nursing home for the virus to come in. We need to develop a solution for that situation. Because, God forbid, there is another virus like COVID or a different virus strain, we will have the same situation presented, and we need a better answer. Living through COVID in New York was traumatizing for me and for many, many others. And it can never, ever happen again. New York was unique with possibly the highest infection rate on the globe. We literally did not know what to do. And even worse, there was no one anywhere who could advise us on what to do. We had the best minds on the globe with us. There was no answer. And society was near collapse. The ambulances couldn't keep up with the number of calls. The 911 lines were overwhelmed. The morgues were filled to the point that we needed to store bodies in refrigerated trucks. The shelves in food stores were virtually empty. Nurses and doctors were on the verge of collapse. The police, bus drivers, civil servants, they were being asked to do impossible work in impossible circumstances. And they did it anyway. We were building emergency hospitals in parking lots. We went to a place we had never been to before, a very dark, frightening, lonely place. And today, looking back, for all the politics, all the spin, all the false headlines, there are irrefutable facts. Our number one goal in New York was to avoid the collapse of the medical system. Projections showed we would need 150,000 hospital beds. The entire state of New York only had 50,000 beds, if you could organize them all and use them all. We needed to slow the infection rate or face catastrophe. And New Yorkers did. It required New Yorkers to change their behavior dramatically. And they did. Changing your life overnight is hard. Isolation is painful. But the state was New York tough. And in New York terms, we would say our people did the right thing. While we came right up to the edge, New Yorkers reduced the infection spread so we never exceeded hospital capacity. And I have no doubt, but for the extraordinary actions of New Yorkers, the situation would have been much, much worse. New Yorkers were smart, even when it was hard. And we followed the science. We did massive testing, drive-through testing sites, massive vaccination programs. We wore masks. We respected social distancing. Our first responders were masterful and heroic. And the numbers don't lie. When COVID started in 2020, New York was number 2 in deaths. Number 2. 1 year later, one long, hard year later, we were number 30 pro rata. New Yorkers did that. From number 2 in 2020 to number 30 in 2021. And in nursing homes, the truth is we started with the highest infection and death rate in the nation, but we rose to the challenge. And by the end of the year, we were number 39. New Yorkers did that too. Of course, any death is one too many. And COVID took many, many, many souls and caused much pain and loss. One thing that brings me peace is knowing that everyone on my team, all the first responders in this state, everyone worked as hard as they could for as long as they could with the best information we could gather, with only one goal in mind: to save lives. We did not play politics in New York. There were no Democratic lives and Republican lives, but only New Yorkers' lives. And I would work with anyone who could help. I worked with President Trump to help New York, and together we did. He did provide military assistance and supplies, and I thanked him for that then, and I thank him for it now. Unfortunately, today the politics still continues. And now, with hindsight, it's so easy to tell people what they should have done. We can all do that. Playing Monday morning quarterback is easy because you never lose a game. But that's not how life works. My hope and prayer is that it never happens again. And God forbid it does. I pray that we are better prepared than we were 4 years ago. That we are now actually competent and responsible enough to learn from the past. I hope we have a government we can trust, we can honor, we can believe, and that acts in the best interest of the people. And that we can be at a place where we put our political differences aside and we work together as one for the good of all. But that is the perpetual promise of America, literally where we started, our founding premise. E pluribus unum, out of many, one. That says it all. It is the only way this country can move forward. And I believe we can. And I believe that we will. Together. Thank you.